The pandemic. Social media is full of advice, but who can you really trust? The pandemic is growing fast and will increase in each of our communities over the next 14 days. You can't believe a lot of what you're hearing, so we need to rely on science and common sense. We all need a trusted source. To help you work through this, I joined 17 other concerned, experienced healthcare professionals to draft our collective advice that we all agree you should immediately do to stay safe. We published our recommendations this week in USA Today, and I want to share them with you by video to try to reach more people. This is not a single voice on social media, but this is the message of 18 of us together, all agreeing with each point for what we should do at this point in time. All that follow are our exact words in the opinion piece. We are concerned healthcare professionals. The pandemic seemed so far away just weeks ago. No one likes to be isolated and sit at home and be bored. You want to be near friends as you work from home. The numbers you're hearing about the virus seem too big to believe. You're worried about your neighbors and the impact on local businesses and workers. You feel healthy, and how much worse can it be than the flu after all? COVID-19 is spreading, and you won't know you're infected until you've already infected others. Right now, you have no immunity to prevent you from getting the disease. It's especially lethal for older people or those with underlying conditions. This will come to communities in waves, and it will be a marathon, not a sprint. So pay attention to local events. And our hospitals won't have sufficient resources, people, beds, ventilators, or protective gear, if cases keep spreading as fast as they are in Italy. But there's something important you can do. Stay at home as much as possible. It may be in your community now, or it may be soon. Until you hear otherwise from healthcare officials, even if you have no symptoms, stay at home. This means avoiding playdates and sleepovers, bars, restaurants, parties, or even houses of worship. Avoid all crowds. Well, what can you do instead? You can still take walks outside. You can shop for essentials and enjoy your online community of friends. Stay connected in other ways. Check in on your loved ones and friends frequently. Keep informed about what is happening in your neighborhood. Give to people in need in your community. Food pantries, financial donations, personal hygiene items. Buy online gift certificates to your favorite local stores and restaurants and use them when this is over. And be a neat freak. Keep everything as clean as possible. Wash your hands early, often, thoroughly. If you're going to spread anything, spread help, compassion, and humor. And above all, do not panic. Remember, like all outbreaks, this too will eventually end. If you've been infected and recovered already, you're highly likely to be immune. If so, you can serve your community in public spaces where others can't. I'll break here and then I'll come back tomorrow to the recommendations that we have all made for state leaders and for health workers. Remember, this advice is not from a single person. It's from 18 of us, including the former Surgeon General, the former head of Medicare and Medicaid for the country, the former U.S. Senate leader, public health commissioners, former White House physician, dean of the Harvard School of Public Health, and that list goes on. I'll be back with you tomorrow.